So I just want to thank everyone today. Thank you so much for joining us. I am Felicia Anderson of the Believers Fellowship, and I am an ordained chaplain. And I thought it would be important for us to have a discussion about the current things that are taking place that directly affect our communities. And um, there is a lot of information that is going out from the current administration and also a lot of commentary based on what the current administration is doing. And so I just thought that it would be great for us to help inform one another on certain things that are going on. And so we're going to be talking about the Safeguarding American Voter Eligibility Act. The acronym is SAVE, S-A-V-E. And this requires voters to provide citizenship when registering to vote, such as a birth certificate or passport. And so while this was initially meant to prevent non-citizens from voting, um, many are arguing that it creates barriers between those who are actually eligible to vote, especially women, because typically you have women, 85, I want to say 85% of women, you can fact check that yourself, 85% of married women change their last name. And so what happens is if you have changed your last name, but across the board, your last name does not coincide with your other identifications, you might have difficulty voting. So your husband might have to vote for you. So we have that. So we're also going to be talking about healthcare policy changes. So the Trump administration's healthcare policy changes in 2025 have had a significant impact on cancer research. This is just one. One of the biggest concerns is the major funding cuts that are going to take place with cancer research. One being to the National Institute of Health, NIH. They give about, if I'm not mistaken, the administration has proposed reducing this budget from 48 billion to 27 billion. Now, 27 billion is still a lot of money, but if 48 billion was not enough to really conduct proper cancer research, to limit that to 27 billion could really delay cancer advancements. And as someone who sits as a director on with the Ahmaud Butler Foundation, whose work is directly affected by children who are fighting childhood cancer and other illnesses, life-threatening diseases, this is devastating. You know, this is really devastating. So we're going to be talking about that, healthcare policy changes. Also, federal education. The current administration has reduced major funding cuts to education, significantly impacting federal programs and student support initiatives. So what does this mean? Because a lot of people hear this and they think federal education, public education, and that is exactly what it is. But there is really, I want to make a distinction that the Department of Education does not directly manage community public schools. So the public schools that are in your area, they still have a right, if I am not mistaken, to govern their curriculums and what they do, but their funding will be affected if they don't walk a certain line. That is my understanding of that. And then we also have one that we're going to be talking about, which is the privatization of detention centers. So the current administration has expanded the use of private detention centers, arguing that privatization will improve efficiency and reduce taxpayer costs. However, communities and human rights organizations are really strongly saying that the accountability and the safety might not work out well for certain communities. You know, Black and brown communities might not fare well under this. And so we have a lot that we're going to unpack and we're going to talk about. And again, as we talked about, you know, prior to this, please let us keep our language respectful. Everyone has a voice here. we see you, we hear you, and we honor your truth and however you know, believe you want to voice yourself. But we do want to say that we want to refrain from using any colorful language to describe the current administration, whether you are for him or not for him. We just want to be respectful and have a conversation where we can actually show people we are able to manage our emotions well. Because that is a great thing to do. And so I will ask that as you are unmuted, or you raise your hand as you want to say something at the very beginning of this conversation, if you could give a brief introduction to who you are, if you have any services or anything, like, we want you to introduce yourself. And I think that it would be great for us to begin with some of our guests. I'm going to ask Andrea Smith if you could unmute yourself.
Okay. Hi, everybody. My name is Andrea Smith, and I am a life coach, a mental health advocate. So the healthcare piece of this will be important to me. But I'd like to start with the SAVED Act, because actually I did not know how much it would affect me. And actually, to this degree, it doesn't, because my married name and my maiden name are the same. So I was a Smith before I got married, and then a Smith when I was married. So it really wouldn't affect me to that degree. But I am concerned about the fact that there are people, and particularly women, who would be affected by this, because now not only do they have to provide their IDs for just, maybe a driver's license or a passport, but now what happens when they have to go to their birth certificate, which basically proves citizenship? How does that affect them? How do they now present something that basically is inconsistent with what they're producing, right? Because normally when we produce our information, we give our voter's registration card when we go to vote. So now how does she work and to be consistent when she's going to be showing, especially if she's going to be asked to demonstrate ID that shows her name across the board? That's not possible to do. So I think that what has happened is that with some of the policies, the nuances of them have not been figured out, because a lot of these policies, including all of which we will speak about today, there are nuances to them that I just think have not been thought about and have not been thoroughly discussed, to make sure that there is no interruption in a service or a program or whatever it is that you may receive, that your family may receive, or somebody else's, a friend or family may receive.
I definitely agree. Now, I want to say that if this bill becomes law, because the last time I checked in again, there are a lot of things that are changing within the executive orders and this current administration. So what you hear last month, as I was preparing for this panel discussion, may be different today. But if this is a law, or if it becomes a law, from the women who I have talked to, you actually, other than your birth certificate, you would have to petition for your social security card to be, your name to be changed on any document you have that will allow you to change your last name, so that it is current and it is, that it matches across the board. So now I will be honest with you. It is just, I have not ever changed my name when I was married. I just haven't. I love my name, and I kept my name. That was important for me to keep my own identity. But for women who want to change their last name because that is a tradition that they are upholding, then you must understand what that means. It means that you're going to have to make sure, if your driver's license says A, but everything else says B, and you have one other little certification or something that says C, they all either have to say A, B, or C. But you're going to have difficulty when it comes time to vote. And that is going to be a challenge for a lot of women. Does anyone have any comments that they want to make to that, or any updated information that you might have? You can just raise your hand and I will unmute you.
I've been hearing a lot of different issues about women and their problems that they may have with voting because of the name change, the real ID, and a number of different things. So I guess for me, it's just a matter of trying to stay up to date with information as it is presented, and recognizing that I need to get in touch with it myself in terms of voting, in terms of the real ID. And I guess also, I think a lot about the problems that a lot of women may have in terms of the name change, in terms of how long they're going to have in order to do that, their voting privileges, and all those other kind of things. So a lot of this information, I think, is good to come forth with. And I believe that this conversation that we're having is right on time to educate all of us about what it is that we need to do.
Thank you. Thank you. So I definitely want to say that while the bill doesn't, I have not read anything where it says that the bill will outright prevent married women from registering to vote. It doesn't explicitly say that. However, when it comes to your marriage certificate or changing your name on documents, it's just going, married women who have changed their last names are going to find it a bit difficult if all of their identifications say something different, have a different last name. So rather than having to jump through those hurdles when registering or when re-registering, whatever lane you're in, it just makes sense to really have that conversation to see if it is easier if you are married, for you to keep your birth name. And I do know that this kind of crosses into, for me, my understanding is that this is not anything religious. This is a tradition. Women do not have to change their last names. It is not something that I have read is a religious obligatory act that you must do. It is a tradition. And if it is a tradition that you honor, then you must make sure that it is the same across the board so that you don't run into any hurdles. And really, that's at the heart of the SAVE Act, is that they're trying to safeguard people from who are not citizens from voting. Topic is the healthcare policy changes. So the current administration, and I'm going to read the notes that I have here, the current administration healthcare policy changes in 2025 have had a significant impact, like I said, on cancer research. I'm sure that there are other changes. You have mental health, you have people who are in drug and alcohol recovery communities whose funding are going to be lessened as a result of, possibly what the current administration believes is overspending, or it can't be justified. Certain amounts, the budget is definitely going to change. And so with that, you have a lot of medical institutions, you have any organization that provides medical care in some capacity to people that are going to be affected. Now, maybe it does not affect us right now, I believe, because with this year, we're still working on money, or budgets are still being worked on from the Biden administration. But now when next year comes, or whenever the next fiscal year comes, I guess, then we're going to be looking at how those budget cuts are going to absolutely devastate certain programs. Is there anyone here on the panel who has anything that they want to share?
Hello.
Hey, Brian.
Currently unmuted. For a second, for what I understand with the healthcare changes, yes, we are not yet on the new physical year, but I believe their physical year either starts in September of this year or January of 2026. So those deep budget cuts right now is running through the House. A lot of House members are kind of changing tides and changing positions based on what a lot of their constituents have expressed to them is something that they are not willing to sacrifice or sacrifice others in the meantime for these deep budget cuts, because the money isn't to say that it's overspending. Yes, we've always known the government to overspend in areas that they choose to overspend: guns, wars, everything but the actual country itself that helps and benefits and generates for the people. But now this big oversight is set to just help with tax cuts. All the money that's going to be taken away from Medicaid and Medicare and the programs that benefit the people with disabilities and special needs, and most people who even have home health care services. Those deep cuts that they're considering now and calling overspending are literally just to help the next wave of tax cuts. So what we're working on and what people are really trying to get in small groups and generate in larger groups is people to call in, sign petitions, and really stand up to their senators and their House, their reps, even at the most locally, go local first and then build your way up so that this thing just doesn't pass by without anybody making a peep about it.
That's definitely important. And I even think that you're right, as constituents, we definitely need to talk to those people who we have voted into office to help us govern things that are really going to affect our families and even ourselves. Consider budget cuts that are being proposed for autism research, mental health and wellness, substance abuse. It's a lot. And the budgets were tight already. Consider, and I'm sure Andrea can speak to this with the mental health. Resources were already tight. Schools are having to really budget off of the current budget that they have. So to say that you're now going to lessen that money, what does that look like? Parents have to get up. Parents, guardians, grandparents, whoever, you have to go to the schools and find out now, how can we help out? What can we do? Advocate peacefully. The one thing I do recognize is that we can't make the government give what they're not willing to give. But if we don't use our voice to say something, it's definitely, it's going to hurt us. It's going to hurt us.
I think one of the things to be concerned about with healthcare, and I know right now we're talking about mental health and things like that, but I guess I had more of a question, is whether or not the healthcare cuts also come into with reproductive rights. So now, are there do reproductive rights, I guess is the question, do they fall up under this healthcare bill? Does that mean that women who are pregnant, will it interfere with prenatal care? Will it interfere with, just the care that they're getting from the time that they, conceive up until the time they give birth? What about the aftercare, with children getting their shots and visits that they have to get and so forth and so on? Do these cuts interfere with that? And is that considered a part of this health care?
That's a great question. So one of the things that I have read is that, yes, the Trump administration's healthcare initiative is going to significantly affect reproductive rights. So that includes There are going to be some cuts, if I'm not mistaken, and everyone please fact check because again, things change as information comes out. You know, you want to make sure that you're fact checking, but cuts to reproductive health research. We want to understand that, well, obviously we understand that there's going to be restrictions to abortion. We already know that that should not shock anyone. That Trump has definitely rolled back any protections for emergency abortion care, and has rescinded policies that ensured Medicaid patients could travel for abortion services.
What I was going to say in reference to the cuts was basically something what you just said, like across the board, and what I'm hearing across the board, but also keeping in mind that although those cuts may come across the board, insurance companies also get to decide what it is that they will cover as well. So you got to think about what the law per se says that they're not going to cover, and what they're going to cut out. And then you have the insurance company that also has their right to decide what in that the law now says you can cover, what they also will decide to cover.
Wow. Thank you. Brandy.
You're welcome.
Okay, so I was just going to answer the question about the cuts. So,
Yeah.
yes, they are pretty much sweeping cuts, but who will be affected the most by these cuts of reproductive rights are those women who have government insurance. Anything that comes from Medicare, Medicaid, if you have that insurance, where the deep cut is going to take place first before it hits the PPOs, then yes, it's going to affect you greatly. Your care, because a lot of these women, this is how they get the majority of their care. It's via their government issued insurance. And I'm not just expressing the ones who were our new system with Penny, where you can buy into it, or if you're not eligible for it free, there's a lower, greater cost to you. Those will be the first people affected by the cuts. And then it'll go up from there. So if you're not willing to do these things, like if your prenatal visit is normally a $5 copay, that could skyrocket up to $75 a copay, which most people may not have. So now you're not getting the prenatal care. So you're putting yourself in harm's way, but not because you want to, because it's your only choice. So when I say that people really, really at this point, the point of contention right now is definitely Medicaid, Medicare, and these cuts that are going to take place, because they affect so many people. No matter what walk of life you're in, that will affect you. If you're in the school nurse, that's going to affect her. That's going to affect the school's budget to have her in your school. Barely school nurses are there maybe 2-3 times a week as it is. Then you have, like she said, the doctors and different places with insurance telling you, okay, well, we can't pay for that anymore. Well, that is important to the mother carrying a baby. Oh, well, we can't pay for the ultrasound anymore. Or can you pay for it out of pocket? No, I can't pay for it out of pocket. So we can't we can't tell the government what to give us, but we can put people in place that are more willing to help us have everything that we need. And right now, who we have and the officials that we've allowed to be where they are, and we've given them this high pedestal, they need to go. That's it. That's all. They need to go. Because they're not serving the best interests of the people. John Fetterman right now, he voted for the Medicare cuts. Weird, because he had a stroke before he became who he was here in Pennsylvania. Before he got to his position, everybody was rooting for him, vying for him, because everybody thought he was a person of the people. He was one of the people who actually voted for these deep sweeping Medicare cuts for all of Pennsylvania. And the majority of Pennsylvania, the majority of Pennsylvania receives Medicaid or Medicare.
So I have a question for you, because I definitely agree with everything you're saying now. So what you're saying, and also to what Jennifer has said, if health insurance companies are going to say, okay, although the current administration, they're cutting budgets, but we're still going to offer you the services, but the only way we can afford to do that is at your expense. So we're still going to cover the service, but your copay is going to be more. How, and I need to understand this, not because I'm pregnant, but I'm just saying, I just need to understand. How does us advocating for our representatives who we voted into office, or maybe who we did not vote into office, but they are there, how do we as the constituents, how do we make them do something how is advocating going to change that outcome and make it affordable for people who cannot afford services because now the copay has went up?
Okay, well, sad to say, when they're saying that the current administration is saying that they want to kick a lot of the expenses for Medicaid and Medicare to the states. The government pays 70% of Medicaid and Medicare's cost. 30% is from the state. So if you kick it to the state already can't afford it. The state is really hands tied to, it's nothing we can do. But the congressional body that is there with the current administration can. So you push into your local administrators to then push on the people right above them to push to the people above them. It's literally a chain. It's a chain mail, and it has to go up the line. Listen, this is not what we're going to stand for. You get a small body of people. Sometimes that's all it takes to say, okay, well, we're not going to vote for that person, but we're going to vote for you. So now we have one more person that's willing to be on your side. So when they tell you you really got to get in locally first, it's because the local people have the ear of the people in Washington. It may not seem like there's such a big impact, but it really is, because there are so many in Harrisburg. There are so many, we got on both sides, but there are so many people who are going to be affected. And those are the people who are taking the heat right now. Our representatives there in Harrisburg, because their local constituents are like, what are we going to do? Because we are the people you guys are talking about taking money from. So now they're going to they're going to John Fetterman, and they're going to Marjorie Taylor Greene. Like, listen, this is not okay for us. Our people home are telling us this is what they can't stand for it. Unfortunately, where we are in this matter, hopefully it doesn't pass, but if it does, the states can't sustain it. So the women who are pregnant currently, the people who are receiving cancer treatment currently, the special needs kids who are like wheelchair bound and have home nurses, it's going to hit everybody, and it's going to hit hard and fast.
Yeah. Yeah. And even in the areas of healthcare, home healthcare, for those who receive that benefit through their insurance, they are afforded to have home care health aides come out to assist them because they can't assist themselves. That funding is definitely, going to be aggressively attacked.
Yeah, I was going to say about in particular with caregiving, because I was my mother's caregiver. And I have to say, during the time when I was caregiving for her was the era of the Affordable Care Act, as we know, as in the streets it was Obamacare, right? But in that time period, it was Obamacare that allowed me to be able to care for her, and the financial burden of doing so was very much lifted from my family, because we had a resource in that particular piece of legislation, along with the things that it did to support Medicaid and Medicare and all of that, because it was through those mechanisms that I was able to get her a primary care physician who would come to my home. I was able to get occupational therapy for her to come to my home. I was able to participate in a program that was called JEVS that allowed my mother to hire me as her caregiver And, you know, I actually did a time card every day that she would sign off on at the end of the week that would give me money, which basically went right back to her anyway. But it allowed us to participate and utilize resources within the system that allowed me to take care of her and for her to be able to get the best quality of care, you know, that I could provide. And she had a team of physicians who were able to support her. And when I'm thinking about what Brandy is saying about how now, because of the deep cuts that could come to Medicare, someone who is caregiving, that affects everything, because that affects the decision as to whether or not you have to put them in a nursing home or whether or not they could stay home, whether or not they can go stay in your home, or whether they could, you know, apply for assisted living. All of these things become important. And I think what has happened is that people disconnect from particular issues because it doesn't affect them in the moment. But then when it comes to you, now it's a whole, you know, now we want to pay attention. Now we want to be more nuanced. Now we want to be more detailed. And I think that panels like this, I hope, will challenge people to not be so disconnected just because a particular issue does not affect you right now. Because it eventually it will in some way, even if you don't have a child that's autistic, or even, you know, my son was an IEP student. That was important. And things like that become will be touched. And just because it doesn't affect you right now, it doesn't mean that it's not coming down later on down the pike. It doesn't.
Does it come a respect? There should be a respect that we have for our elders. And because they're vulnerable, they are part of the vulnerable community. And because of that, if you're saying that we're not giving money, the families need to be responsible. What if the families aren't responsible? And what if the families are responsible but don't have the money? It is just really, really unfortunate that the defunding of these Medicare assistance programs, you know, are just taking place. Yeah, it's definitely heartbreaking, because who among us haven't had someone that we have taken care of who required and needed these programs at full capacity? And even at full capacity, it was not enough, but it was more than what we're being told is coming down the line.
Yes, as I'm just sitting here listening, and one of the things that I'm thinking about, and I just have to talk about my own personal experience. As I've gotten older, um, there have been some things that I'm starting to recognize that I may need. And what I'm hearing now is that where you going to get them from? Because the services that were available clearly are not going to be available. Um, and when I think about even the elders that I've come to know over the years that benefited from the programs that are in place now, if those programs cease to exist, what's going to happen to a whole generation of our elders? And the other part of that for me is, how do we, or what is it that we can do right now, along with this kind of community activity, to move in such a direction that we can get somebody to listen to us and hear what we're saying about the needs that are coming about? Because the reality of it is, when I think about the elder situation here, it concerns me because the resources are going to be limited. The care for the elders are going to be limited. And so how are we going to move forward? What kind of activity can we now begin to involve ourselves in? And who and how far can we go in getting to the people that are going to be able to help us navigate through this? And that's my main concern right now.
Mhm, mhm.
Because as I'm hearing, and there's some things that I know about, I'm mental health, drug and alcohol, and all of that. But the reality of it is, I already am aware of the fact that they have closed two major programs in this city in Philadelphia, and they are closing like next week
Mhm, mhm,
out of the blue. They're just closing, and
mhm.
everybody's going, well, how come? Why? We don't know why yet. But these are dangerous times, really, for all of us, I think. And this is what we're doing right now, I think, is a great start.
Amen. So circling back to elder care, I want to say, and Chaplain Jennifer, you're already unmuted, and Brandy, I do see your hand. I want to say that one of the things that can work, and of course, I think every family, every community, if you know an elder who lives alone and maybe doesn't have the family support that they need, and you have it in your heart to be neighborly, what we don't want, and I think that everyone on here, for the most part, can remember that episode of Good Times when the neighbor said she had to eat dog food from time to time because she couldn't make ends meet. And so in order to make ends meet, she did it to the detriment of her own health, because dog food isn't, I mean, our bodies will consume anything we put in it, but dog food is for dogs, right? But that's what we do not want. And we don't want for our elders to make life decisions in the grocery aisle. No one should have to be burdened with that. Now, if you are a family, you may very well want to start discussing now, do you have room in your home for shared living? The one thing that shared living does is it splits the expense of the cost of living, so that you have extra money for medical things that are going to come up. We cannot avoid, health. No matter how good your health is, at some point you're going to have some ebbs and flow. To your health is going to be up and down. So you want to make sure that you have some additional money. So shared living is an option. If that is not an option for you, then you may want to sit down with some of the elders in your family or in your community and really look at, if they allow you to look at their budget and see what is more of a luxury item versus a basic necessity.
Yes. What I was going to say is, as I'm listening to everything, the importance of when you receive paperwork in the mail, or when it comes time for you, whether it's private and your Medicare, your HMOs, all those things like that, it's very, very important that you read the information that you are getting, that you read the booklets that you are getting. And when you don't understand something, please take the time to make the phone call to say, I received this, I don't actually understand this. What does it mean? Because a lot of times we get the information, we skim over it, or we go to the health fair and we pick up the booklets and we say, okay, and we see something in there that we might like, right? But then when we think about the benefits that we have, we forget, oh, how is this going to change? And we see something new being added on, and we may have skimmed over that per se, because something else has gotten our attention. And I have been through that a little bit with my mother at one point, where she received something in the mail. It sounded good. She switched over. But then when those benefits began to kick in, they weren't like the benefits that she previously had. And those benefits that she previously had were much better. So we just have to really be careful about the information that we're receiving in our mails, make sure we read it. And again, if you have any kind of questions, please, please, please call those numbers that is on the literature that they send out to you. Make sure that if your council person is having something, I see them doing a lot at rec centers, churches and everything, go ask the questions. Even if it might not be the subject that you need right then that they're speaking of, you may be able to pull somebody aside and say, hey, I'm concerned about this. Can you help me answer this question, or where can I go to get the question? Now is the time, like you said, we have to be advocates for the elderly. We have to be advocates for our neighbor, our family members, and advocates for ourselves as well.
Thank you. Thank you. Brandy?
I was really just piggybacking off of what you had said and Chaplain Franklin. With when you get to the certain point in life and you need these benefits that are now slowly being taken away from you. I am currently like before me who worked really hard and was just active and had tried my hand at every job I could ever try was great. I then had spine surgery, not one but three. So I'm now currently disabled. So I am now the Medicare patient that this whole thing is about. And those cuts will affect so deeply. And when you said the elder care and getting together with your community and being neighborly and going to those people, or maybe starting a community garden in your neighborhood that can start generating food that other people can eat so they don't have to eat dog food per se, those are the things that we can do. We can take these empty lots that are beside the house. The city is already willing to say, okay, if you want to let that be a garden, that's fine, as long as it benefits the community. So we become the community that it used to be, and not this new version of our community where we are so disconnected from one another that we feel like what affects you doesn't affect me. Your house is on fire, as long as it's not next to my house, it's okay.
Mm-hmm.
Because if you remember some time ago when John McCain was in office and he had gotten sick and he got cancer, he was so opposed to Obamacare before he got sick and he got brain cancer. But Obamacare's brain cancer and life-saving treatments is what kept him going for so long. In the end, before he passed, he became such an advocate for Obamacare because he didn't understand what it was like to be a person who couldn't have that care until he was a person in that position.
Wow. Wow. That's deep.
But we can get together with the things that we can do. No, we may not be able to storm down to the Capitol and act a fool. That is not for people of our color.
It is
But
not. Learn a
what we
line dance.
can
Learn a
do
line
is
dance.
what we used to do is be a community to one another.
That's right.
We can help each other. We can save one another. We've been through tougher times than this world has ever seen. We can survive it and actually come out on top of it, because the greedy people are going to be greedy and greed is going to be their demise. But if we come together and we stand strong and we hold firm with each other and say, hey, listen, okay, you might not have the $10 copay, but maybe I have it. You might not have any vegetables, but I do have some. I have enough to share. And like you said, come in your home and share and say, hey, listen, maybe 5 of us need to live together now. If there's 5 of us, we can make it work. But that's the community aspect of it. We need the community. This panel does help. We reach out to more people. We make it larger.
Yeah.
Yes.
When I grew up, this was a survival kit that my grandmother taught me. You should have, well, I don't know, eggs is probably not an option right now, but beans, you should have rice, you should have a Mr. Coffee pot. I'll tell you why. You need to have an electric, like one of them little burners that you could like plug up to cook on. You need to have some electric blankets, heating pads. You need to have flour, cornmeal. There were certain staples that were always in my grandmother's house. And I would say, well, you use the percolator. She used to use that silver percolator to make her coffee. Child, make the best coffee. But she said, no, the reason I have a Mr. Coffee Pot is because if times get hard and I have to figure out which bill I'm going to pay, whether it's going to be gas or electric, if I keep the electric, we got heating blankets and y'all could do what you need to do because I can afford the electric bill. And we can still cook and we can still heat up water. If we need to make soup, we have beans, we have rice, we have things that are going to make it pasta, grains, so that you don't starve. And so there was always a pantry of things that my grandmother had, and I saw her having it grow up so that if there was no running to one of the marts because she was out of something, because she always made sure she had it, because she understood hard times. And I think that life has afforded many of us many luxuries that our grandparents didn't have, and so we don't see life that way until we have to see it that way. So the Trump administration in 2025 introduced major funding cuts to education, significantly impacting federal programs and student support initiatives. And some of them are elimination of federal education programs, meaning closing the Department of Education, shifting responsibilities from K through 12, kindergarten through 12th grade, and higher education entirely to state governments. This means that federal oversight of education would be eliminated, leaving states to manage their own school funding, curriculum standards, student aid programs, all on their own. So while you have some people that argue this reduces federal interference, there are also some people that are saying that these disparities are going to affect certain districts of lower income persons.
Federal funding, as far as the federal funding goes that comes into the school. So if you think of the Americans with Disabilities Act, which also includes children, school-age children, that's federal funding. That money goes so there's ramps in your school, so the kids in wheelchairs and kids with special needs and disabilities are able to actually go to school. That's one. Two, with the in poor neighborhood, all your property tax is directly related to what schools in your area get funded and how. So the lower income in the area, the worse the school is. The better the income, the better the school. The more funding it receives. But federal funding is directly tied to Title I schools, which is the majority of schools in poverty-stricken neighborhoods. So that's majority of Philadelphians are below the poverty line. So that is pretty much every school here except for a handful of schools. Like the archdiocese aren't directly affected most times because they can do away with their Title I funding and they can go directly from private contributors. Public schools cannot. It's the reason why they're public. They're open to everybody, so they can't change their rules. They can just change the amount of students that they can then service. They can say, okay, because federal funding also plays a part in the meals that come there, because the majority of Philadelphia's public school students are afforded free lunches. So we go back to SNAP and the benefits. All of that comes from the federal funding. If it's kicked back to the states, education as we know it for kids in lower income neighborhoods is done. They're already struggling. They're already shooting each other. You don't want to take school away from them. And a lot of times, if you can't go to school, school is some of those kids' only reprieve from actual life. They get peace and quiet. They get meals. They find somebody who genuinely cares about them because there's a teacher or somebody in the school that singles them out. Like, you know what, I want to take care of this kid because they're not being taken care of in other ways. Schools are so detrimental to our neighborhoods, but that is the plan. The plan is to do away with poor people. We are a liability. Our elders, yes, they've worked hard. They've gotten to where they've gotten to. But if they're not here anymore, that's one less month. That's one less mouth the government has to feed. Poor kids, one less mouth the government has to feed. They figure we'll feed on each other. We'll end each other.
Wow, wow, wow. And even at the college level, federal funding for programs like work study, TRIO, Pell Grants, it's going to be harder for low income students to afford college. How about the reduction in civil rights protections, OCR? So within the Department of Education, they've seen about, I want to say over $35 million in budget cuts, which this is what it means. It makes it hard for them to investigate discrimination cases in school. Some crimes are going to remain a he said, she said, because there is not funding that will allow them to properly investigate discrimination cases. Now, that's frightening. Student loan policies, federal loans, loan forgiveness, those programs have really scaled back. So it's going to limit it's definitely, it's going to limit the help that people get to repay those loans. So it's going to increase the struggle that people already have with debt. And so the mindset of shared living may not be palatable for everyone. Some people, listen, you cannot come live with me. But we're coming, community life is going to make it so that that might have to be a viable option, just so that people can live and survive. And so I think that each of us, we really need to really consider, how can we help those who are in our lives, whether it be through our bloodline, through our friends, our extended families, people who live in our neighborhood. What can we do to help our immediate neighborhood? Brandy said a garden, you know, I suggested maybe when you go shopping, if you can afford to buy extra food, you know, if you're stockpiling food, or if you have a pantry, you know, maybe you can have other items, have a garden. These are things that we really have to think about. And then when we think about them, we have to move forward on that plan. It can't always be like, conversations are great, but when we all click off, at what point are we actually then going to put it into action? How are we going to become community advocates? How are we going to become those people in our neighborhood who will help push forward the experience that we know? You know, not everybody nowadays, not everybody got a big mama or has somebody who is teaching them basic skill sets of life. Like if you buy a lot of rice, you need to buy bay leaves. Why? Because bay leaves are going to keep bugs from eating up your rice. You know, like certain common things, like things like this that we may not necessarily know, but we can teach and pay forward the wisdom that we have with one another. Yes, Andrea, you're already unmuted.
So I wanted to talk about, just quickly, as somebody who, this is interesting for me, but as somebody who works for county government, and who works for a department within county government who partners with high schools to bring in high school students to be interns with us. And so we have a partnership that with a high school where we bring in students who come in, and basically the purpose of the program is to not only teach them about estates and trusts, but to also now give them the springboard to be able to learn how to work in a professional environment. And so when they first initially come in, there is a program through their high school where they are actually paid through. But now once they come out of high school and they remain with us now as a part-time person, because they can still do that. They can come back and forth, you know, as they transition into college and so forth, they can still come back and work. And that money, they're now paid through the county when they come in. So now as I'm looking and we're talking about how, you know, federally funded monies can be cut, that is a program now that can be cut. That is something now that may or may not have to go away because of the funding that's connected to it. And I just go back to the point how we just don't realize how so many things that happen are connected to what we do, right? I'm a product of the Philadelphia school district. So when I got married, and I live here now in Delaware, you know, I brought my son here because, you know, I wanted him to receive a better education. And fortunately enough, by moving here, it afforded us the opportunity to give him, even though it is still, technically, it is public education. There are schools here that look like college campuses, right? My son's high school in particular, I'll even say from his elementary school, when we took him to the elementary school and they're giving us a tour, when we went in a music room, every table or desk had a keyboard on it. Never saw that before. You know, went to they got computer labs in elementary school. Then now when he gets to middle school, it's the same thing. When he gets to high school, now we're touring the high school, and he's got one of the banks has partnered with the high school to actually put a mini bank inside of there where the kids can work as tellers, and they can, make deposits and all of these different things, and learn what it means to work in a bank, and all of these different things. And I'm looking and I'm like, well, I guess this is my tax dollars at work. But, here in Delaware, 36% of Delaware, Newcastle County's budget, I'm going to say 36% of it is towards education. So that means that now there's going to be this divide. I think that what Brandy was alluding to is that there's going to be this divide between have and the have-nots, because because a portion of the 36%, we know now is money that comes in federally. And who is that going to hurt first? That's going to be the folks that live in the city, those that live in the city of Wilmington, those who are educated in those areas. It's going to affect them first before it comes out here to the quote unquote suburbs where I live, right? So should I not? Now I'm challenged because, okay, my son is 28 now. Now, I don't have any ties to the school system per se. But I'm challenged now because just because my child is not in the system, it doesn't mean that I should not advocate for those who are. So I'm challenged with this to think like, hey, you know what? Just because I brought my son through a different system, it does not mean that I should now not be considered or considering those who may be affected by this. I think that sometimes we kind of harness our vote to our own thing, not knowing what our vote is connected to. And I think that that's what happened. That has been a part of what's happened in this country with this last election. People became very isolated with their vote, not knowing or not even considering, I'm going to say, what your vote was actually connected to. You may have, your issue might have been eggs, but as we can see now, it was really not about eggs, right? And so I just think that I'm really challenged in now that, okay, I need to really consider a little bit more, not just my own thing right here, just because I don't have kids in high school, I don't have a kid that's in the system. I need to think about the kids that's in the system. And even I'll stop with this, is with school choice. School choice is a divider to me. I know that there are parents who want to, be able to pay for their kids to go to somewhere else. But if you dig deep into school choice, you will find that those who want to do school choice or those who can afford to send their kids where they want, but they still want a subsidy. Well, no, I don't want my tax dollars to be used for a subsidy. If you can afford to send your children to private school, then you and your husband need to work that out. You're not going to use my tax money now to get a voucher or to get some type of subsidy when you can afford to do it. But if you delve into school choice, you will find that is one of the battles that people go back and forth about when they talk about school choice.
Wow, that was good. I want to say that you're right. For many of us, and even myself, I didn't always understand what my vote was tied to or what my cause was. One, because I work, I'm busy, I have health challenges, I got family, I'm trying to duck people who want to borrow money, I'm going like I'm living life, right? And so and I lacked civic education. And as many of us do, we don't understand basic civic education. We're not literate in poli-sci, so to speak. We know whatever if you're Democrat, Republican, or independent, you know that, and you vote according to that without understanding that attached to your vote, like you said, are things that will affect you locally. What judges are you putting into office? The Congress people that you are voting for, what do they believe in? Because just because they look like you doesn't mean that they support what's important to you. And just because they don't look like you doesn't mean that they're going to be against you. So we definitely have to be literate in civic education. And I think it's the complexity of policies. We really want to know, the average person wants to know, how is this going to affect my money? That's it.
Mm-hmm.
But how it affects your money is just more than how much you're going to bring home that you're going to get to spend at the mall or spend at the hairdresser or whatever you do with your money in terms of luxury. But how is it going to affect you feeding your family? How
Mhm.
is it going to affect you paying your bills? Those kind of things. Now, what are you going to be responsible for? You thought that the list that your educators sent home to you to buy your children that list of supplies with glue, pencils,
Mm-mm.
whatever it is, and you thought you was hemming and hawing about that. That was a big complaint. Why do you might have to mess around and buy a laptop or a tablet. So we definitely have to understand and have a basic level of civic education. And there is nothing wrong with saying, I don't understand the complexities of policies. There are some things I don't understand because I haven't been afforded the time and accessibility to understand it. I'm working. I'm trying to hold on to my mental health. I am trying, to raise these children. I am just trying to survive. So for me to get involved with what politicians are doing, at the end of the day, they're going to do what they want to do anyway. So my vote doesn't count. And I've been there. I have literally been there and believe that. But I think what convicted me, one, is because when I have conversations with Chaplain Franklin, who's also my uncle, when I talk to him and I listen to him and other of my elders who really say there was a time when you better vote because you knew what was going to happen and take place in your community if you didn't. It is important for you to vote because if you don't, then you are a part of the problem you're complaining about. Even if you don't believe that your vote counts, vote anyway. Detention centers. Detention centers. So the Trump administration introduced major funding cuts not only to education, healthcare policies, and all things like that, but also to privatize detention centers. What does this mean? It means that racial profiling and and immigration enforcement, minority communities, the Black and Brown and Indigenous populations will begin to see, at least this is the concern, that we will begin to see increased. So whatever we're already seeing increased racial profiling to enforce certain laws that we're not that we don't quite understand, but yet people will be detained, they will be stopped, they will be questioned, and it gives the appearance that to have detention centers privatized is just that. Privatized means, it sounds like it means they have their own laws and their own governing body and how things are going to be done. And for a lot of people, this is very scary because treatment in detention centers are deplorable. There's been inhumane treatment of detainees, minority detainees in particular, are saying that they are facing high rates of neglect and abuse as a result of being in detention centers. So if detention centers are now privatized, what does that say for our loved ones who may be detained? Does anyone have anything that they want to say about the privatization of detention centers? Okay, I saw Andrea's hand go up and then Chaplain Franklin after you.
Was the detention centers, we talking about prisons and stuff too, right? Or are we just talking about juvenile centers where they're just taking you? Does detention centers encompass prisons too?
Yes.
So it encompasses prisons. Okay. So this to
Now,
me now.
and I want everyone to fact check that, but last I checked, what they're calling the privatization of detention centers would be any facility that would house who they have deemed to be a criminal.
Okay. So now that to me speaks to how does this connect to the George Floyd Criminal Justice Act that they were trying to pass. One of the biggest hurdles in that piece of legislation was the qualified immunity for police officers. So now if you couple that along with having we are privatizing detention centers. Now we have a twofold issue. We have police officers or probably even security or sheriffs, because I don't know who's going to be in these detention centers. I'm assuming they're going to be police officers, sheriffs, or whoever, who now under a private entity, the governance of them is even less, right? Because to some degree, they're only being governed by, it's just like working at your job. You're only governed really by your own HR, right? They're the persons that really deal with what you do and how you conduct yourself, unless it becomes something major that now has to take it outside of their governance. But that's what I'm hearing when I hear privatization. I hear an entity that is now able to govern itself and to police itself. And how does that help? If they're able to police themselves, if they're able to police the conduct of their employees, the guards, the whoever that is, who for the most part who are the ones who are most engaged with the people who are there, that to me is frightening, because I would never want to see anybody go into a prison or anywhere and not be afforded the opportunity to be protected and taken care of in a way that is humane. Now that's what I'm hearing. I am hearing of the possibilities now, even though some prisons are already inhumane. Now I'm hearing that we're getting ready to go to another level of that when we're talking about privatization, because I think a lot of people, when they hear privatization, they hear a reduce in federal monies. They hear, oh, that's money now that the federal government don't have to pay. That's money now where my taxes don't have to go to. But yeah, your taxes are still going to go to it, because still, if it's within your community, somewhere along the line, your money is still going to an entity that doesn't do exactly what it's supposed to do. So I think it's what makes people feel like it's the right thing is because they think their money is no longer attached to it. Just like you was alluding to before, Felicia, that when people think their money isn't attached to it, then they think it's a better thing. No, really it's not. And the private detention center is not going to be, like I say, with all things, is not going to be a problem until your son and daughter is in that detention center.
That's right. That's right. And so, here's some of what privatizing of detention centers or prisons look like. It means restoring private prison contracts. So under the current administration, President Trump rescinded President Biden's ban on federal contracts with private prisons, allowing companies to operate federal detention facilities again. This means increased profits for private prison companies. So now I want everyone to fact check on their own, but after President Trump won, private prison stocks soared because they were anticipating to receive more government contracts for the privatization of prisons. So concerns over safety and oversight, exactly who is left to prioritize prisoner safety over making money, higher rates of violence, confinement, inadequate medical care, compared to government-run facilities. So if it's privatized, do you have immunity? Exactly what does that mean? But if you're making money, and I want to say that if you live in certain communities where your kids go to school and they have to walk through metal detectors, they're already training them. They're already getting their mind together.
But one of the things hello everybody, one of the things that's going on here in New Mexico that we found out, that was on the news yesterday, is that they're using the armed forces to come and to help with traffic stops, with crime scenes and things of this nature. They're not allowed to arrest anyone but they're allowed to detain you before the cops be called in. And we found that out yesterday. It was on the news yesterday, and I was just wondering, has anyone else in their area and hearing something like that, where they're starting to use the not the National Guard, but the National Guard to come in and end up helping out the police force? They can't arrest anyone, but they're doing all the other things to try to help free up the police to go do their regular jobs.
No, I've not heard of that, but I do know that certain things, certain policies are being put in place to weed out those who are immigrants to see if, are you here legally? Now, I remember if there was still snow on the ground, so this is how far back this was. There was still snow on the ground. And I went to the doctor. Excuse me. I went to the doctor when there was a form and this was a City of Philadelphia health center I went to, and there was a form that I had to fill out to let them know what my nationality was, my ethnicity, my nationality, where I was from. And I was told if I did not fill that out, I could not see the doctor. And I said, well, I have insurance. Like I work, I have employer-based insurance. That's neither here nor there. Before your doctor can see you, you must fill this out. In essence, they were trying to, and then they have to report it, because and this is what was told to me, because I asked to speak with the supervisor. If they want to continue to receive federal funding, they must ask every patient these series of questions. I guess because if there is anyone who can't prove that they legally belong here, then there is a tracking of that. So I have seen those things in place. I've not seen exactly what you're referring to, Chaplain Cliff. Anyone else?
No, I have not heard that. I think a lot of this depends upon the color of your state. And when I mean color of your state, whether it's blue and red, for the most part. I'm in a blue state in Delaware. The issue of immigration is really not here, because it's not. I mean, we don't have the, I'll say that large of a community where the vetting of the citizens within this state is looked upon in that way. So no, I certainly have heard of it, across the board. And me, like you, Felicia, I have gone to the doctor, even when I was in the hospital a few months ago. And when I was in, they had a form for me to fill out to say, what's going on. And I've had family members who laugh at me because I carry my passport everywhere I go. They're like, girl, what you got your passport for? Listen, and this is all before all of this started going down, but I carried my passport, I carry my birth certificate, I carry all of that stuff with me. Had no idea that now, I'm probably going to keep doing that, because at this point, we just don't know.
That is true. That is true. Thank you. Chaplain Franklin, you wanted to say something, and we're going to come to a close. We're at the 12:30 mark.
Okay, I just wanted to share something about the privatization of institutions, jails, for lack of a better term. I worked in a prison some years ago, and one of the things that I remember well was that they had this whole notion about medical research. Now, this medical research was designed for certain inmates. So if you were on 14 block, you were assigned to have to go through medical research, meaning that you were indoctrinated, or you were given certain types of medication, certain types of food. And the interesting thing about it, and I found out about this very shortly when I was working there, was that there was a selection of the inmates that they did this with, and it was inmates that didn't have family members. It was inmates that didn't get visitors. I soon realized that I was not built to work in that kind of institution, based on that. And when we talk about privatization now, the one thing that I think about is that privatization means that, and for lack of a better term, once you're in here, I can do what I want, when I want, with you anytime I get ready. And there's nothing that anybody can do about it because this is private. We're in charge of it. We have our own rules. And if you violate any of our rules, there's a board that we will have, and we can do exactly what we want to do under this whole Privatization Act because nobody's going to be allowed to come in there and do any scrutiny because the board are the people that own it, the people that manage it, and that's what they mean by that privatization.
Yeah.
I just wanted to share that.
Thank you. I remember learning about the Holmesburg prison experiments. I think it was like, was it in the 50s or 60s or something like that, where the inmates, and this was in Philadelphia, where the inmates were subject to skin treatments to see what certain chemical agents would do to them, radioactive substances in the name of medical research or scientific research. They were using them as guinea pigs to test out different things before it was, I guess, then introduced to the public at large. But when you are in a private prison, it's just that it's private. What are you going to do about it? You were here, you committed a crime, and there you have it. So I definitely want to, is there anyone who has any any brief comments before we end this conversation? I thought this was good. And I want to thank everyone for joining. If you do have any final comments that you want to make, please just raise your hand. But one thing I want to say, I want to reiterate what I said at the beginning, that whether you agree with the current administration or not, it is always so important that when we use our voice sticking to the facts and sticking to what it means to the communities that most affect us, but also having a heart to extend to those communities that do not affect us. Because, you know, we spoke about the have and have nots. You know, I don't know which community you belong to, but whichever one it is, there's another community on the other side of that coin. So if you understand what is important and what is valuable to you, then you should understand what is important and valuable to all of humanity, whether you identify with them or not, whether you agree with them or not, whether you would ever sit down and have dinner with them or not. I think if you've ever been hungry, you understand that people have a right to eat, even if they're not going to be in your company when it's done. So we have to have a basic level of humanity for everyone. And it is important that when we're talking about this current administration or any other, there is always going to be something that is not going to be well for the community that we are a part of. And I think this was a great conversation because we did not come here to we did not come to spew toxicity. We came to present the facts as we understand them and try to navigate that. And I think that that's great. So I do want to thank everyone for joining. And like I said, I think that these community awareness Zooms are things that we definitely should do more. I learned a lot here today and I'm grateful for it. So everyone, thank you so much. God bless you. Enjoy the rest of your day.